morning, everybody. Thank you. Thank you again. So tonight, you know, we're here. We started talking about that. We're going to be doing something new on talking about how people communicate with their healthcare provider. And that is going to be, this is our first time we're doing that type of program. So it's going to look very special for our audience out there. And we're glad that we have Dr. Thrower and Tracy to work with us on tonight's program. So in addition, though, to tonight's program, we have now done over 200 programs since February of 2010. Over 200 programs. And we're now doing this in 13 states because there are just people everywhere that need to know about multiple sclerosis and want to hear more about it. So in addition to doing all these programs, though, we have our learning channel, which is our YouTube learning channel, which is what I spoke about. And also on there, there's over 200 videos for you to see about everything, basically, you want to know about MS, you could find on that learning channel. In addition to that, we now offer something that we may not have done the last time that you may have seen us, and that's we have social work services now happening. We have an 800 number. So if you ever need a social worker because maybe you don't go to the Shepherd Center, maybe you do something different and you need a social worker and don't know who to contact, you could contact our social worker and she will work with you. And if she cannot work with you, she'll find a social worker near to where you live and that person will then be contacted as well. So tonight's program. Tonight, we want to thank Tethered Neuroscience for giving us the education grant to be able to provide this program, and I hope that you all can help us and say thank you to them as well. Don't just rub your hands. Yes, put it together. Make it loud. Let them know that we're all happy that they did this for us. Thank you. And also, we have our other exhibitors, our sponsors that were here tonight. Some of them were exhibiting, some of them were just sponsors for the program. So we want to thank them as well. You know, MS Views and News has been around now, again, just since February 2010. And we came about and we do these things because I also have multiple sclerosis. So for those of you out there that don't know and want to say something to me after the program, good or bad, I'm here to listen to you. We now have a new slogan that we're using with MS Views and News, and that is simply that we believe in empowering all of you with MS information. So this is something that you're going to start seeing in a lot of our paperwork that goes out, and we just want you all to know that no matter who you are, the patient or the caregiver, we want you to be empowered with as much information as that you need. Thank you. All right, next we're going to have Tracy Walker. And Tracy is going to take the steps. No, you're going up that way too? Uh-oh, okay. I'm glad she didn't fall. All right, so Tracy's going to speak with you about adherence and things to do with invisible symptoms. And, well, you could tell them. All right?
Yes,
so thank you. Great, thank you.
Thank you guys for coming. It's good to be here, as always. You know, it is sort of like going back to our old days when we could have fun, and I regret not taking this opportunity to share with you some of my historical pictures of Dr. Thrower. I must have been too busy today to think about it, or I got wrapped up in my Star Wars geekness. I hope there are some more Star Wars fans in the audience because if not, it might be a long half hour for you. Sorry. But anyway, so today I get to talk about some general MS issues, mainly adherence. We're going to talk about the importance of adhering to whatever treatment program. We're going to talk a little bit about symptoms. Most of you know I can talk all day long about symptoms, so I have to limit myself. But we certainly can talk more afterwards if you have specific questions. And then we're going to talk a little bit about just general tips and build some more on what Dr. Thrower said about making the most of your health care. So I am relating all of this tonight to the Force, okay? The Force is real, okay? Those of you that have seen Star Wars, you know it's real. It surrounds us all. So we're going to talk about that. So adherence, the definition of adherence, I loved this when I looked at it because I love the word steady devotion. You know, we talk about adherence, or the old word used to be compliance. And of course, nobody liked compliance because that sounded like your kindergarten teacher was telling you what to do and you were going to get a paddling if you did it, right? So adherence is the new term, but I think the words on this definition describe it better than even that word does. And it's really important. Newsflash, medications don't work if you don't take them, right? The thing about MS, though, is because many of the symptoms are invisible, and many of the time we're trying to look at how you're doing over the long haul. If you're not, adhering to a medication regimen, that throws a whole nother monkey wrench into the picture, right? Are you not stable because that medication's not working for you, or are you not taking it optimally? So it really is a big issue, and MS patients are not unique. The statistics say none of us take our medications. In fact, I have a doctor's appointment tomorrow that I've rescheduled twice because I haven't been doing what she told me to do. So there you go. We all do it. So rule number 1, take your medicine, you will. I would have put take your treatment because, there are other things we use other than just medications, but it didn't sound like something Yoda would say. So there has been a lot of research looking at adherence to different treatments in different disease states, and they've all found similar things. The people who adhere to their treatment regimen or seem to do better with that are people who already feel empowered and know that they have control over their treatment. They're people who have a sense of hope about treatment and their future, and they have confidence in their treatment. So those are kind of some patient-focused things. Then there are other things that also fall on your provider, and some of the questions, reflected that tonight, because if you don't have confidence in what your provider is recommending for you, or you don't understand why they recommended this injectable therapy versus an oral therapy, or a switch versus a not switch, if you don't understand why we're saying what we're saying, then you may not have the confidence in what we're recommending that you would have if we took the time to explain our thought processes. And the difficulty is, I think, especially more and more with our medical system and challenges that we face, is many times in our head, we've got that algorithm or, those things that we're checking off in our head, and we may, not realize that you aren't checking off those same boxes, or we're not communicating to you what we're checking off. So it's challenging because we have less time and fewer visits many times, but we have more to talk about. So now what we have to do many times is ask people to come back. Review this information, talk to whoever, then come back and we'll talk about it again. So it can be challenging, but it's really important to understand what the treatment is that's being recommended and why. So rule number 2 is, I missed my punchline down there. The bottom is fear of Darth Vader's chokehold. Might be keeping some people adhering to their treatment. So factors that contribute to non-adherence, I'm guilty of this a lot of times. I can make some simple instruction really complicated, right? Instead of one sentence, I can write you a whole paragraph saying the same thing. And so a lot of times it's challenging for us to make a treatment plan as simple as possible so people can have better success at adhering to it. Then also we need to let you know what our expectations of the treatment is and understand what your expectations are. Because, not only is it, a lot of people say, let people know what the reasonable expectation is, but if you have a certain expectation that we know we're not going to meet with this particular treatment, then we need to really have a conversation about what we could do to meet that expectation. So maybe your disease-modifying therapy isn't going to give you more energy, but maybe we can look at doing that through symptom management or through therapy and wellness activities. So that's the kind of conversation we have to have about what treatment is going to have the best effects and where we feel like those effects will be. The other thing is, medications and different treatments, they have side effects. Even natural products can have side effects, right? So we've got to talk about, okay, if you experience this, or you may experience this is what some other people have told me, or what we've seen in the clinic, like a stomach upset, for example. Many medications can cause stomach upset. Some of them, it might be the first dose and then it goes away, or others of them may last for a while. Well, that's important for you to know whether that could happen or not, so that you can monitor for that and not feel alarmed if it does happen. The other thing that I think is challenging with MS is there are times when maybe you don't have a symptom that reminds you of why you're having to take that shot every day. So sometimes that waxing and waning of the symptoms of MS can be a challenge to adherence. Depression, Dr. Thor talked a little bit about that. If you're depressed, many times you're not motivated to do what has been recommended to do. Cost is a big issue. Now maybe usually we joke in the clinic sometimes, and it's not really a joke, but it is, you're better not to have any insurance than to have bad insurance. A lot of people have insurance that only covers after they've paid $15,000 out of pocket, So that can be really challenging. So many people are counting up those copays and have to even make priorities lists in terms of what medications and what treatments they feel like are the most important. So cost is an issue. Thankfully, a lot of times we can connect people with assistance for that sort of thing. And, I've seen patients before, they lost their insurance or something happened and they didn't know to let us know so that we could connect them with assistance for that. So be sure your provider knows if you have challenges or concerns about that. And we talked about the poor confidence, and maybe you don't take your medicine because you're part of the Rebel Alliance. So rule number 3 is understand what treatment has been recommended, why it's been recommended, how you should take it. And I love this because I have lived this for more years than I will admit. So he says, I'm fluent in over 6 million forms of communication, but I can't figure out this doctor's note. So, visible symptoms of MS. MS is one of very few conditions where you can have very visible symptoms or you can have very invisible symptoms. Unfortunately, a lot of people have some of both, but they have a lot of different implications for patients and their family members and their day-to-day life. So visible symptoms of MS, walking difficulty, like Dr. Thor talked about, the incoordination, weakness, tremor. Those things a lot of times patients will express feeling self-conscious about. They don't like to go to certain places or do certain things because it may be more visible to people. And then the other side of the coin is the invisible symptoms. The invisible symptoms can be really challenging, and at least they don't have that visible flag, but it's also challenging to have a symptom or experience something that nobody else can see. So, patients often say, I feel like I'm constantly explaining or repeating, or I feel like my family doesn't understand or doesn't believe me, those kind of things. So it's challenging for people. And I know, having had different symptoms in the past, that sometimes you start second guessing yourself. And I have patients ask me all the time, am I crazy? Is this all in my head? It's like, well, it's in your head, but it's because of the MS that's in your head, not. So those invisible symptoms are challenging too. Now, the invisible symptoms that I'm including on this list could be, expounded on. I would argue that bowel and bladder are a real invisible symptom too, because people don't talk about it. I love that commercial now on the radio. It's some bowel treatment that they talk about, the embarrassing things to happen to you, but talking to your doctor about your poop shouldn't be embarrassing. And that's so true. We're medical providers. We should, we're comfortable talking about that. And that's one of the things that you want to be comfortable with your provider so that you can share with them your symptoms. Now, you may choose to talk to the nurse that works in the office instead of the doctor, or the doctor may say, go talk to that nurse. But, talk about it, because if you don't talk about it, then nobody can help with those issues. But with the invisible symptoms of MS, these 4 I like to group together, because I say that they usually are there all together. So fatigue, depression, and cognitive dysfunction, I refer to those symptoms as the 3 sisters, because they're always together. They're always aggravating each other. If you treat one and you don't address the other 2, then you don't make a lot of headway with the one. So you have to kind of treat all of them to a degree to be successful for any of those symptoms. So then pain, I say, is their aggravating little brother. He's running around getting them all worked up and causing trouble. So those 4 symptoms are things that many times, if you're having one of them, then think about, are you having any of those others? Because they can contribute to the intensity, just like the sleep and the fatigue. If you're tired all the time, then you're probably going to be depressed about that, right? And then there's depression that goes along with MS. Some of the treatment choices to treat fatigue and depression also treat each other. So many times we can try and minimize the amount of medication you take by trying to choose something that may hit more than one symptom. Another example is sleep and muscle spasticity, or sleep and nerve pain. We may choose something to treat the pain that helps you sleep at night. So that's why a lot of times reporting all of those symptoms can be helpful. I think, one of the things that can sort of impair communication between patients and their provider is when patients can't really describe something. Now, sometimes you can't describe these symptoms. It just sort of changes all the time, and there's no rhyme or reason. But many times, if you take the time to really think about it and maybe even jot some notes down, or talk to your family or friends, you can come up with sort of, okay, well, when does the symptom happen the most? What makes it worse? What makes it better? That's one of the questions I ask. If Tylenol makes it better, okay, that tells me something. If Tylenol, Motrin, nothing helps, then okay, that leads me in another direction. So those kind of things are something that's part of the algorithm that we go through in our head, and the questions that we are thinking and want to know about the symptoms. So one of the other invisible symptoms with MS that we don't talk a lot about is sexual dysfunction. And, again, that really could be grouped with all the other symptoms, because the sexual dysfunction can be due to fatigue or pain or spasticity, or it can be more of a primary issue, maybe loss of sensation or erectile dysfunction, something that's a primary result of the MS. So something else, to be sure you're noting and talking to your provider about if you're experiencing. So Yoda says, "Understand me not, does my wife." So invisible symptoms can definitely cause a lot of issues between family, friends, and just cause a lot of angst for patients. A lot of times patients feel like they don't want to talk about what they're experiencing with their family or their care partner because they feel like they're always talking about it. And, to a degree, I do recommend that patients have outlets other than just their family or friends, even if it's a paid, counselor or psychologist, because sometimes you just got to let it all out. And you may not be able to do that or feel comfortable doing that with your family or friends. But sometimes these invisible symptoms can change the dynamics in a relationship, change the dynamics in the family. There are certain roles that may be typically done by a female, housework-wise or whatever, and maybe they're physically not able to do it anymore. So maybe they have to switch some of the responsibilities, or maybe, somebody usually does the accounting and the bills and all of that, and cognitively are having trouble doing that and have to switch that role to someone else. So I think the biggest thing to remember is communication. And I like it when family and care partners come with patients so that we can put it all out there and talk about it. Many times it's just the process of talking about it that helps lead people to a solution themselves. So education is empowerment. So what you're doing tonight, and hopefully what we can continue to do with these programs, is empower you to understand your MS better and to facilitate your being your own advocate. Knowing what questions to ask and what expectations to have of your provider, and when to say, hey, you know what? I was thinking earlier when you were talking about, what do you do when you have a provider that you feel like isn't meeting your needs? Well, if you have a way to switch, great. If not, that's an adult conversation to have. I really am not feeling like I'm getting my needs met here. I feel like I need this, this, and this. I've had patients actually talk to me about that before. And sometimes, we're human. We may not know that we aren't meeting your needs. So sometimes that conversation helps build that trust. So don't be afraid to say to your provider, your healthcare team, hey, I need something more here. So also with these educational offerings, you can get the up-to-date information. You can ask your questions. You can get information on reliable sources. With the age of the internet, you can find things a lot of times, and it looks legitimate when maybe it's really not, or maybe it looks like a big, huge discovery when it was only 5 patients. So it's helpful to be able to find accurate and legitimate sources for your information. So information, they've done studies about how, the effects of education and information. And what they've found is that when patients or when people have more information, then they're able to recognize, especially in health crises, whether their responses are normal. A lot of people are like, I feel like I'm going nuts here or something, and when you provide information that, hey, that's a normal reaction, Another example is grief. There are stages of grief, and we know that. And sometimes informing people, okay, at first you feel angry, then you feel, and you move through those stages, it helps people know that their response to whatever they're experiencing is normal. And it helps people communicate about what they're experiencing better. And then it leads to better problem solving. So in the clinic, when we're talking to patients, that's a big thing. If we're getting adequate information and sharing adequate information with you, hopefully we can come to the best decision without having to go through, lots of visits and problems with that. I wanted to include this because I hear, and I, as a mom, know how, our tendency is with children to protect them, not to, share a lot of information. And a lot of mothers with MS will tell me, I don't want my daughter or my son to know about this. And I think it's important, there are some things that you don't need to share with children, but in general, when you're experiencing a chronic illness, information is good because children tend to blame themselves for stuff and come up with their own answers or own thoughts if you're not providing the facts for them. So rule number 4 is every good Jedi must learn the Force. So just some general tips about mastering your health care and being sure that you're getting the best of what you can. First of all, I would say is seek good providers for your health care team and realize that you need a team. Like Dr. Thrower said, we're not good primary care doctors. So be sure you have that primary care doctor to help you in navigating all those other issues that are not part of your MS and that may, cause you a lot more problems than MS. And then if you feel like you're seeing somebody who's not meeting your needs, explore other options. And this is a good venue for that. MS patients share their experiences and they know many times who the best expert is for different issues. So like Dr. Thor said, make notes and be prepared to ask your questions. Have your priorities out there. I love it when I go into the room and a patient says, well, I'm sorry, but I have my list. I'm like, that's awesome. That helps us navigate and be sure that we have discussed the things we need to. And then bringing a family member or a care partner is really helpful because, yes, they can help kind of give feedback about how you're doing, but also it's a learning process for them too. And many times, it can help validate or help the patient feel more confident in what they're saying when they have friends or family that are saying, yes, I've noticed that, yes, or she complains of this a lot or that. So it's important. I think the biggest thing is never surrender. This one is for Dr. Thrower. It's a Star Wars political cartoon, and I love it. Yes, so there's Yoda Kasich. There's Princess Fiorina. Carson 3PO. Darth Trump. Cruz Solo. I love it. All right. Any questions? The Wookiee is Jeb Baka.
All right, we'll take questions now for anybody that's got them.
We got questions. You had questions on symptoms, so where are they? I know you do.
Okay, right here. First.
Tracy, I have a question. I see both yourself and Dr. Loring, and it's very difficult, which is a compliment to you guys of how busy you are because you're so good. And my question is, if I want to make an appointment, is there, since there's several of you, would it be a big deal to say, okay, if Dr. Loring's booked 3 months out, can I see if Dr. Thrower's available? Or, I mean, are you guys seamless that way, or do I wait for Dr. Loring or you, or how does it work there?
Yeah, so different practices have different models, kind of. In our physicians, although they're all very different from one another, they complement each other really well. And I think most of the time they're comfortable covering, but I think our model is more that your doctor is your primary doctor, and then you can see any of the mid-levels if they're urgent, issues, the nurse practitioners or the PAs. But, the first priority is to meet your need, whatever it might be. So, we can be flexible in that way. But that brings up a big question that I talk about in a lot of programs is be sure you have time to ask your provider, especially if you're newly diagnosed or you're going to a new provider, ask them up front before you have an emergency. Okay, if I have a problem on Saturday, who do I call? What should I do? Some providers now are set up that really, if it's a big issue, you're going to have to go to the ER and be treated emergently, so that may save you waiting an hour to get a phone call back, right? So that's always a good question to ask up front.
When I was first diagnosed, Dr. Loring put me on some steroids, and I had a horrible reaction, and he was on call, and so he calls back, and I tell him the symptoms, and he's like, God, you should go to the ER. And he just hung, and that was it. He's like, you should get to the hospital. And I was like, oh my God, I really look at, these are the doctors that everyone's been telling him about that I have to go see. He's like, you really should get to a hospital, right?
Yeah, that's bad. That's bad.
Hi, Tracy. This wasn't so much a question, but when they were talking about being constipated, I find for me, Calm really helps. You could get it in a health food store, and you dissolve it. It's magnesium, and that really helps.
Yeah.
Is that Be Calm? Is that what you're talking about? The stuff at the health food store?
No, it's called Calm. It's magnesium.
And it,
Put it in juice or water. But you have to watch it. You have to make sure you have the right amount, because you could get diarrhea, and then maybe you got to use less of it. But
Yeah.
it's very helpful.
yeah. So magnesium supplements are one of the things we may recommend for some folks, and that's a good source of it. The thing that's challenging about bowels, and also the thing I love about it is there's lots of different bases you have to cover, lots of things you have to address. And so that's one of those things where I say, come in and we can talk an hour about that. But there's a lot we can do in that hour to make a difference. So good suggestion.
I have a question for you. It's been asked many times. What is the right height for a person who needs to use a cane to address the cane to their body?
Ooh, that's a physical therapy question. Do you know?
Yeah, we really. Wait. Sorry. Oh, gotta get the microphone. I don't think there's a set ratio, because a lot of it depends upon whether your hips or your pelvis is level or not. So really, like Tracy was saying, I like to refer people to a physical therapist, because I think one of the biggest disservices we can do from our end for a person who has walking issues or balance issues is to tell you to go to CVS, Walgreens, and just buy something over the counter. We actually get slugged by the physical therapist when we do that, because there's equipment that's right for you and there's equipment that's not right for you. I can recommend a single point cane for someone and actually make them more at risk for falling. So it's not just the height; it's is it a quad cane or a single point cane? So I would really defer that to a physical therapist.
Thank you. Thank you. Any other questions?
I am new to this whole MS situation with regards to being not really a caretaker, but I'm there. My question is, for instance, if they have an episode, if they fall or they do, I mean, sometimes I don't know what to say. Sometimes I don't know if I should just let them go, deal with it. Do I comfort? What do I do? Or should I just stand by and let them tell me what to do? I don't know the best way to.
First of all, great for thinking of those questions. And second of all, I would say that's exactly what you need to do is ask them how would you like for me to handle this? Because some people, it's a very personal preference. Some people, they don't really want to talk about it. They just want to, get through the immediate issue, whether it's get back up and go or what. Other people, feel more comfortable if you acknowledge the struggle. And, sometimes it's just, I feel like you're having a bad day today. Is there something else I can do? Do you need anything? Sometimes it's a simple thing like that can really open the doors to further communication.
He's forcing me to ask this question, but I'm going to ask it. All right. First of all, I had a tethered spinal cord, and I didn't know about it until I turned 50. So I had that surgery done to untether my spinal cord. So I've had tingling sensations in my hands and in my feet before I even knew I had MS. Now I know I have MS. In January, after 3 years of doing injections, now I'm taking a pill. And I seem like I can feel that tingling more now with that pill. And I'm like, is it my mind? Or am I just, what? Or is it the medication that I used to do actually solve some of that? Or I don't know what it is.
Yeah, and sensory changes might be another invisible symptom that's hard for people to describe and figure out. And I would say that's definitely a legitimate question for your caregiver, because that definitely has an algorithm that, okay, we need to check this, we need to check that to narrow down. The challenge with MS a lot of times is the way we can figure out that it's your MS is by ruling out everything else. So, we may be 95% sure, okay, that's the way you're describing it sounds like your MS, but we need to make sure we're not missing, a orthopedic issue or a medication side effect. So, I would try to notice when you're feeling it, and if you're tired, or if if there's anything that's making it better, making it worse, position, activity, those kind of things, make some notes and then talk to your provider about it. Yeah. He's got some dad.
I would just add that with one of our pills, in particular with Aubagio, we've had to become very aware that one of the side effects of Aubagio is peripheral nerve damage, and that gets to be really tricky. If you have numb and tingly type symptoms, that can certainly be your MS. You've got the added wrinkle of having the tethered cord, but one of the side effects of Aubagio is numbness and tingling in the hands and feet, and if it's something that starts after you start Aubagio, let your healthcare provider know, because we need to do nerve conduction studies and make sure that's not the Aubagio, because that's a reason that we would actually stop that drug if it is a side effect of the medicine.
She's going to make me run back and forth here, right?
Totally different, yeah.
All right. Any other questions? There you go.
To follow up on.
I'm not running back and forth.
If you had that feeling before, your hands and feet, the tingling and whatever, and you recently switched to Aubagio and you're noticing that it's getting worse, but it had always been there, that can, because I love that drug. I don't want to go off that drug.
Yeah, I mean, so the nerve conduction studies can tell us if it's a medication side effect that's going to continue or possibly worsen versus just some fluctuation of your MS symptoms. So, right, yeah.
Any questions on that side of the room that I don't have to run back and forth? If not, I have a question for you all too. I don't know if you all know, but I know a lot of people with MS. Haha. Okay, so a lot of people ask me with their own symptoms, what can they do to do more in life than what they're doing right now? And I tell them they have to speak with their neurologist or nurse practitioner. But what if I personally see that a person is not giving enough, where I think that they could be doing more if they apply more, rather than saying, I have MS and I just want to sit around and do nothing? What can be said?
Well, I think number one, other patients with MS are good sources of information, because you have that, legitimacy to say, hey, what about this? What about this? Are you doing those things within your control to help? Because I think, I say this to patients a lot. Yeah, I used to, when I saw folks back in the clinic and they said, oh, I feel so much better, I'd get excited because I thought, ooh, I wonder what I did. What medicine did I start them on to make them feel better, And then I realized that every time it was that they changed their lifestyle. They exercised more, they ate better, they took care of themselves, they did things that they needed to do, and that's why they felt better. So I think, we as medical providers a lot of times will default to our medical treatments because we assume people are thinking about those things, when in reality we need to emphasize more the wellness and the activities that really can make have a lot more benefit. I think many times in that situation it may be that they have some depression that's not treated. Because if you don't feel like doing anything, then the world seems terrible and you don't have that hope. So sometimes treating the depression can help build that hope and help people have some confidence that maybe they can do something to make life better. So
we've got one right here.
I heard of a drug that can help you walk quicker. You see me keep on going back. Yes, and I don't remember what the name of it. My walk is so slow. And is there something that could help you to walk quicker?
So there is a medication called Ampera that's approved for walking issues with MS, and when they studied it, that was the major outcome, was the speed of walking. What the drug actually does, we think, is help those nerve fibers keep conducting, and help them maybe with that nerve fiber fatigue that Dr. Thrower was talking about. So sometimes people can walk further, not just faster, but there are issues with the medication in terms of making sure you're a good candidate for that and making sure you give it an adequate trial. It's definitely one of those drugs that people have to give a certain amount of time to really see if it's beneficial. If you have a history of seizures, you don't want to take the drug. So it has its own little algorithm as well. But yes, it is a possibility, and something to ask your provider about. Well, the most common side effects really with it's activating somewhat, especially at first. So people sometimes will have trouble sleeping for the first week or two. Usually that resolves over time. You can have more urinary tract infections, so we watch that. The seizure issue is a big issue. We need to make sure that you don't have a history of seizures and that your kidneys function properly. It's generally pretty well tolerated, actually. And I think there are people in the studies that responded to the drug and people who didn't. So again, we don't know who those people are. So we have to be sure we're giving it, a trial to see if you're a possible responder or not.
Well, how much time do you have to take to try it before
They
you know?
actually have a 60-day free trial program, so I tell people the minimum of that 60 days, unless you're having some sort of negative effect from it. I, would even rather 3 months as opposed to 2, but that 60-day I think is the minimum. Yes, your neurologist should know about it.
Okay, question over here.
Well, it's not a question, but it's a comment, and I know that you're taping this, so it's important to me as the wife and the caregiver. When my husband was first diagnosed, he was already in his late 60s, and he went to a leading neurologist here in town to find out why he was falling. And we were just told, you've got MS. Goodbye, that was it. No thing to make life better. And I said, okay, we're going to Mayo's Clinic. And we went to Mayo's Clinic, and we were told right then and there how lucky he was with the type of MS he had, and to start getting exercise, working with the trainer, get gait training, work on balance. And to me, I think that's what the whole community needs to know, the whole medical community. It's not a death sentence. You don't just send somebody home and say you've got MS and that's it, because he was older when it really showed its head. And so that's what I'm hoping, that since everybody sees Stuart's things and stuff, that they understand there's a way to tell people and a way to encourage them to go forward. And my husband, God bless him, works out with the trainer and has since the day he was diagnosed 3 times a week. He can now stand on a BOSU ball for 2 minutes or longer. And,
That's awesome. That's awesome. That's one of the things I'm so proud about working at Shepherd, because they really do have that comprehensive team, and it is important with MS. And so sometimes if people see a neurologist that, maybe is not part of a comprehensive center, they may have to seek that out more so, but it is tremendously important, absolutely. Oh, excellent. We love it.
What would be the extent of the first consultation, so far as who I would see and who I would deal with and ask the questions of?
So I'm sorry, I missed the question.
What would be the extent of the examination or the consultation?
Oh, okay.
My first visit?
So, different providers do it differently. At Shepherd, the new patients are seen by the neurologist initially. And then usually they would review your records. We ask that you send those to us so we can kind of have a preview of what we need to talk about there. And then, talk about what your concerns are and what recommendations in terms of all those 3 areas that Dr. Thrower talked about. And then, see what referrals do we need to set up for you. In terms of community resources, whether it's a wellness program or therapy or, financial assistance or whatever. And then soon we will also be asking you to fill out some papers in terms of what we call patient-reported outcomes. So you will have, at some point, somebody will ask you to complete those so that we can kind of get a baseline of where your MS is, so that we can measure that moving forward in terms of some measurable outcomes. Then when you're in the clinic, we may do things like timed 25-foot walk. We may do neurological exam. It depends on what the priorities are, what we need to do.
What was my question? Okay, why are UTIs so common? I mean, I know we take a lot of medications, pills, whatever. We drink a lot of water, I would think. So is there something else we can take to kind of help?
Yeah, the issue with MS and UTIs a lot of times ends up being whether or not you're emptying your bladder completely. So sometimes when that's a mild issue, there are things we can teach you or do medication-wise or whatever to help with that. There's also some high-powered cranberry supplements that can help in UTI prevention to some degree. We also would talk to you about fluids and all of that. MS, because of the range of effects it can have on the bladder, you might need further testing to be sure that we know exactly how your bladder's functioning and what's leading to the UTIs. But I would say if you're having frequent urinary tract infections, definitely see your neurologist and ask about that, because it definitely makes people with MS feel really bad, exacerbates a lot of the symptoms from the MS.
We have another question on this side, and then we're only going to do two more, and I see there's one on the left and there's one on the right after that.
Okay, I live on the south side of the city in McDonough. And so you guys and even MS Center of Atlanta are far away from me. When it comes to exercising, I hate it because it didn't work for me when I was 8 years old and had surgery because of the tethered spinal cord. And I tried really hard and never anything happened. And so I literally hate exercising. And now that I got bad foot drop, what do I do to exercise? Because everybody says that's what you need to do.
Mm-hmm. And that you're the perfect person to go see one of our therapists. If you could make a trip, your neurologist could refer you to a physical therapist, but they can help you figure out, number one, what exercise would be the most beneficial for you so that you're not doing something you don't enjoy for longer than you have to, okay? And then maybe find something that you don't hate as bad, because there are a lot of things that, can fall under the realm of physical activity that might actually be somewhat enjoyable. So I would say ask your neurologist to send you to a physical therapist. And then hopefully now one of the things that our therapists are trying to do is build that network out in the community and educate YMCAs and, different wellness providers about the special needs of MS patients.
Mine is kind of a two-part question, and my sister's probably going to kill me when I say this, but I always said to her she needs to eat more. If you don't have, eat enough, you don't have the muscle mass to do anything. That doesn't mean overeat, but I'm always telling you need to eat more than rabbit food. This is not cutting it. Somehow you need to get a little more muscle mass so you can move, but then again, maybe I'm wrong and I'm thinking, okay, if it's a neurological thing, maybe with muscle mass or no muscle mass, it's not going to work like we want it to work. But it just seems that if you have a little more energy or a little more fuel in you, things would work a little bit better. That's the first part. So I'm telling on her, but I don't know if I'm totally wrong thinking she needs to eat more than she does. I mean, I know she's trying to eat healthy in a healthy manner, but it seems she needs a little more something to get a little more strength.
Well, and I think this is a good point about MS because, there are some things that your body needs that are unrelated to MS. I mean, you need air and oxygen, and you need fuel. And so, if you're not eating adequate meals and enough protein, it can make fatigue much worse. It can make weakness worse over time. So absolutely, having an adequate intake is important. And protein, I think, is important. A lot of times people forget that you need that protein to build muscle and have sustained energy.
Okay, let's thank Tracy. Thank you very much. Thank you. This program was called The Land of MS, and I don't know if you all got one of these when you came in, but it's a tool that you can all use whenever you see your clinician next. All right, anything and everything about multiple sclerosis that you have questions for, you can find on here and bring it to your healthcare provider so that way your session is complete when you leave there. You're going to go with questions, but there are times that you may forget to write something down. Well, if you had a tool like this available to you, you fill it out, you start filling it out a week or two prior to your visit, and you write down everything that's bothering you so that when you go see Dr. Thrower, you remember to ask everything that you intended to ask, and you're not waiting for him to find why you're there, okay? By the way, this isn't just accessible by coming to our meetings. We have this available off of our website. It's right there on the homepage. So if you visit our website, you can find the Land of MS tool. You just click on it, and you can download it from there. You could also fill it out right online if writing is a problem for you. So that's something new that we developed for that as well. For those that have problems writing, again, you could just fill it out online and then just print it from there. So this is a tool, though, that a lot of neurology offices already has of their own. Just make sure you get it from them in advance, so that way when you see that person the next time, that you could be using their form with whatever's on there as well to, just fill out and bring with you. But these are the ways that you can achieve better communication with your healthcare team, and that is to have something like this available to you in advance of your appointment. Again, I want to thank Dr. Thrower and Tracy Walker for coming down here today. Thank you very much. And I want to thank you all for coming, because if you didn't, we couldn't do this program. Please, on your way out, go out that door and see Jill sitting at the scooter there, and she will be waiting for you to drop off your seminar evaluation forms, because we need to know what you thought about the program or what you would like to see us bring to you the next time we come up here. And again, thank you to Teva for giving us the funding to do today's program. Thank you very much, everybody.